Thank you, Congresswoman Sutton. We will first take a question from Ben from Avon Lake. Ben?
Oh my God.
I'm sorry, are you talking with me now?
Ben, are you there? Yes, please ask your question.
Yes, ma'am, I'm here. Yes, I'm sorry, because I had talked to somebody else. Thank you very much, Congresswoman. I appreciate this time. The things that pertain to me, as well as I imagine many other people in the country, is that I think people want their country back. They want to be part of the process. They're against the larger and growing expenditures that Congress is making. What is concerning to me is that I'm just concerned about how this is all going to happen. I'm a small businessman. I only employ 2 people, let alone not myself. But the biggest thing is I really don't know who's running the show out there. Is it the White House? Is it Congress? Or is it special interest groups? And that's where I have the concern. Big government, larger payrolls to support the government in this particular process. And I'd like you to respond to that, please.
Well, thank you very much, Ben, for participating and for asking your question. And I can hear your responsibility to civic duty in your tone as well as your words. I think that it's important to look at how this bill will be paid for, and I hear overtones of that in your discussion because it's critically important, and it's been made very clear by the President as well as most of the Congress, and certainly it's something that I believe, that this bill has to be budget neutral. It cannot add to the problems that we have in terms of financing. So we're going to pay for the health insurance reform so that it doesn't increase the deficit and burden future generations. I know that I wish a lot more of that had been done in the past than currently has. Now, currently the bill, the CBO, the Congressional Budget Office, has stated that the bill is fully paid for and budget neutral. Now, how is that accomplished? Fiscally responsible reform means we're considering a lot of ways to do it, and the provisions that are in the bill include things like increasing efficiency and getting savings through that, reducing administrative waste, obtaining savings from that, eliminating fraud and abuse, obtaining savings from that, expanding our use of proven cost-saving preventive and wellness measures, and improving the accuracy of payment in current federal health programs. Now, the bottom line is that the growth of health care costs will flow under the program. And what is also extraordinarily important is what we can't afford to do, because the spiraling cost of health care in America today is not only it's threatening our entire health care system. And unless we act, we're going to have unsustainable growth. Every year, Americans are being asked to pay an additional $1,800 in spiraling health care costs. Now, in addition to that $1,800, Americans who have coverage, who are paying premiums, whether they're paying them by themselves or partially because their employers are paying for them, or sometimes employers pay for all of the premiums. Those premiums build in a hidden tax of $1,100 that every American is paying through their health care premium costs to cover people who aren't insured under the current system. So it's really important that we recognize the cost of inaction and continue to try to find ways that we can improve the cost efficiencies under the system while at the same time making sure that we don't lose any of our health care outcomes and beneficial health care outcomes. Thank you, Ben.